Next up is mold. So please mark all the symptoms that you have. So fatigue, muscle weakness or cramps, joint pain and stiffness, sinus issues, so postnasal drip, nosebleeds, very cardinal sign, sinus congestion, chronic sinus issues, sinus inflammation, chronic cough, headaches, including migraines, tinnitus, or basically a ringing in the ears, itchy ears, ear drainage or fullness. Oftentimes people will report having a fullness in their ears, or hearing loss. Oftentimes people with gastrointestinal issues, so bloating, irritable bowel, diarrhea, and gastroparesis, which is basically like a neuropathy or a nerve issue having to do with the gut, because mold and mycotoxins are neurotoxins. So they're toxic for the body, and any place that you have a toxin that it is affecting a nerve can happen really anywhere in the body, and that's kind of what we're seeing here. These mycotoxins will also irritate the lining of the urethra and the urinary tract. So you'll get urinary symptoms like pain with urination, increased urination where you feel like you're urinating all the time, and excessive thirst. Mold and yeast will feed off of each other, and so you'll get an increase in vaginal infections, including vaginal yeast infections. Or I should say, yeast infections, including vaginal yeast infections. And some other neurologic. So this is the nerve. These are the nerves in the brain, causing dizziness, disorientation, tremors, paralysis, numbness, and tingling. This also includes the how the mycotoxins trigger the immune system. So the immune system and autoimmunity loves to attack the brain in certain parts, including the cerebellum, which has to do with balance and orientation. And so you'll get problems with that. Mood swings is a big one, anxiety, depression. Brain fog is a big one, problems with attention, learning, and memory. People can have vertigo, a metal taste in their mouth, mold sensitivity, so reacting to moldy places. If you walk into a house or a building and you smell mold, or you immediately start to feel a tingle or brain fog in the sinuses, you know to leave that space because you're being exposed to mold. And then the testing to do, looking for mold in your body, is going to be the GPL mycotox, or the urine mycotoxin test. It needs to be provoked with ready-sorbed liposomal glutathione, 450 milligrams, twice a day for 7 days prior to testing if you're able to tolerate glutathione. If you start taking liposomal glutathione and you start to feel badly, immediately stop the glutathione and just do the test at that time, because that indicates that you're flushing a lot of the toxins out of your lymph and other parts of the body into the bloodstream, and you're just feeling worse because you're being re-exposed to it and your body's not able to get rid of it because you're pulling it out and not able to get rid of it. So that is what that is. So, and then the ERMI, the Environmental Relative Moldiness Index, is a great test. It looks at DNA of the mold in the home, so you can test your environment for mold. And then if we need to know exactly where the mold is, since the ERMI basically does a whole space, you're basically taking collections from throughout the space. ERMI really is the best test. If the ERMI test is above 2, is significant for pathologic mold or disease-causing mold in the space. And so we use, if we're trying to determine exactly where it is, it's too expensive to do the ERMI for each test or each section of the home. And so using something like the Immunolytics mold test plates, which is looking more at mold spores, which is a less expensive option, and you can put the petri dishes out in certain parts of the home. It doesn't look at mold toxins, but or mycotoxins or the DNA, but it does look at the mold spores, which can give you an idea. Now, if there's just mycotoxins present, there's just DNA present, then you're not going to get anything positive on the immunolytics test. However, you've already done the ERMI, you know that it's present. So then you just need to have somebody in to look at, what are the moisture readings behind the doors, or behind the walls rather, where is the mold, where is the leak that you need in order to be able to determine where the mold is. And then the laboratory data is elevated levels of the mycotoxins in the urine according to the lab test, the ERMI greater than 2, and the mold test plates positive. Education. In my experience, it is very likely that someone has mold toxicity in their body if they have 2 or more of the above symptoms and the elevated levels of urinary mycotoxins. The asterisk symptoms are especially indicative of mold toxicity. Sometimes the urine mycotoxin test is normal, even if someone has mold toxicity and the test is provoked with glutathione. So very important. This occurs if their detoxification pathways are clogged. In these situations, doing the test without provocation or treating based on symptoms is advised. Here's the conclusion. Choose yes or no and proceed.